Now, the federal government is being urged to come up with a list of criteria to diagnose and combat long COVID. Canada's chief science advisor spoke earlier about irreversible health consequences and the economic cost. All of this adding to the huge strain on hospitals right across the country. So for more on this, let's bring in Sarah Galashan. Sarah, take us through the latest on it.
Yeah, Hannah, let's start with the hospitalizations, because we heard from the health minister at this press conference is that in terms of available doses of children's medication, there's another 2 million now available within the country, and as well another 800,000 expecting to be made available throughout this week and into next. The hope is that children's medication will go some way to easing the strain on hospitals, which we have been reporting on at length. What we heard today at the press conference is that according to the Impact Network, we're seeing higher than expected hospitalizations in the age category of 10 years to 16 years old. That would be compared to a peak season flu in years prior to the last 2 years of the COVID-19 pandemic. But by and large, the highest hospitalization rates are right now children under the age of 5 years. And subsequently, because we are seeing such high numbers of those young children being hospitalized, we are also seeing those high numbers, higher than usual numbers in the ICU. And sadly, in the number of deaths that we're seeing as well across the country. Flu really is nationally the issue. Nationally, we are past the peak of the last COVID resurgence, we were told, and RSV, we were told as well, has leveled off across the country. And in some parts of the country, we are starting to see that go down to what be more normal levels. Now, that said, on COVID, and you mentioned this right off the top there was an update from Canada's chief science advisor on efforts to better understand the symptoms of COVID that for some people last much longer than that a 10-day illness. For some people, COVID is an acute illness, but what we were told is that, and we've been told this before, COVID is also for others a chronic illness. And she said there's so much that we still don't understand about it, but we do know that it is affecting at least 15% of adults who are experiencing these long COVID symptoms. We still don't know exactly why some people are affected this way and others are not. We don't know why women are twice as likely to be affected by long COVID symptoms, which can include things like brain fog, exhaustion, flare-up of previous ailments, diabetes. She is urging the government to develop a criteria for diagnosing, and she says that there's not just health benefits to that, important health benefits, but also economic reasons to do so. Take a listen to what she said.
Estimates from the U.S. suggest that 10 million people with long COVID could carry an economic cost of $3.7 trillion a year when you take into account lost quality of life, lost earnings, and higher spending on medical care.
Sarah, Quebec also spoke about the illness that the province is seeing there and recommendations over the holidays. Tell us what you heard there.
Yeah, Quebec's health minister, Quebec's public health officer, sounding the alarm or that they are concerned about higher rates of COVID-19 over the holidays as people start to mix and don't listen to those recommendations about wearing masks in crowded settings. Currently, they're seeing about 200 new hospitalizations per day in Quebec. We're not talking all COVID, of course, but based on what has happened in the previous 2 years, they are very concerned that there could be a resurgence, and if there is a resurgence of COVID-19, what that does to the hospitals in Quebec. So with that in mind, here's the advice to Quebecers.
There's certainly a risk of increasing contagiosity in the communities, and with that, as consequences, more people would get to the hospitals and need to be hospitalized, and probably more death in relation with that. So there's a message of being really careful with that.
Now, that is advice. It is not a public health order. He doesn't believe that an order is necessary in this case. As far as the flu goes, something interesting that was brought up is that it's possible that Quebec thinks they have maybe passed the peak of their flu, the peak of their flu season, but and a word of caution here, they're going to take a few weeks to look at their numbers more closely to ensure that's the case. Hannah?
Galashan, thank you so much.
You bet.
We want to dig into this story about long COVID a bit more. What do we know about it? How big of a problem is it? So for more, we want to bring in Dr. Leslie Fellows. She's a professor in the Department of Neurology and Neurosurgery at McGill University and practices at the Montreal Neurological Hospital. Welcome to the program, Doctor.
Thank you.
Now, we heard Canada's chief science advisor urge the government to talk about, figuring out how to diagnose long COVID. Is there any indication out there right now how to do this, and what is the level of urgency on it?
Well, I think it's clearly urgent for us to better understand what people who feel they're having symptoms that have stretched long past the acute phase of COVID. What are the causes? What's happening for them? There are recommendations about, kind of broadly speaking, how to diagnose what's called sort of post-acute COVID, syndrome. But at this point, it's really descriptive. It's sort of saying, well, symptoms have lasted more than a month or more than 3 months. They could be related to COVID, but we still don't really know what the underlying causes are, which makes it hard to be crystal clear about diagnosis. And in the end, that's what we need, right, is to understand causes so we can be more systematic and thoughtful about how to treat.
And also, there's a wide range of what you could potentially be feeling, everything from a brain fog to flare-ups of previous ailments. What would some instances that would go to you, oh, this is long COVID?
Well, your point is very well taken, and I think that's the medical challenge. Is the symptoms that people have are what we call non-specific. Most of them, fatigue, brain fog. These are symptoms that can be seen in many health conditions. What makes them long COVID is that they've happened after COVID. Of course, in an individual, it may or may not be directly due to the COVID. It can be hard to sort that out. So I think what we're seeing is that there are certainly some people who are having a multitude of symptoms. Often people have more than one. There are certainly people who are quite incapacitated after COVID, who are not able to work as they were working before, who are not functioning physically as they were before. They have symptoms such as fatigue, brain fog, anxiety, rapid heart rate, all kinds of symptoms. Are these all due to the same underlying cause? It's really early days for us to be figuring out the mechanisms, but we definitely need to be engaging with people with these symptoms to try to understand what's going on for them and to try to help them deal with the symptoms while we work out what the causes might be.
Now, there is this Quebec-wide effort, you're involved in this as well, that includes the Neurological Hospital. It's an online study looking to better understand the lingering effects of COVID-19 infections. It is still early, but can you give us a sense of what you've learned so far?
Yeah, this study, Quebec Action Post-COVID, is an effort to really just understand. We've gone directly to the public, asking people who believe they have long COVID symptoms to do an online research project. And we're seeing that people who respond to the survey so far, our first 300 patients that we've been able to look at, they're suffering. They have a lot of symptoms. They have a lot of functional impact. And they tend to have several symptoms. They're mostly not reporting just a single problem, but a cluster of problems. We're still working on the data. We're hoping to be able to report on something quite soon in terms of an initial experience. But what we're really interested in this project is the long-term evolution. We know more and more about the short-term picture, not only from our study, but from other studies across Canada and internationally. But we have much less information about how things are evolving over time, and that's obviously going to be crucial information for people with symptoms now, what to expect, and also for healthcare services to be planned to support people. Is this something that lasts months, years? Are there things we can do to help people feel better? I think it's early to know the answer to those questions.
There's also a CDC study out of the United States on this just today. The study found long COVID can also be deadly as opposed to just causing that long-term illness. Based on your reading, what should we take from those findings?
Well, first of all, I would caution people not to feel alarmed by the word deadly attached to long COVID. I think that study it's based on death certificates. It's really just looking for whether the word long COVID was on the death certificate. It was a tiny, tiny fraction of all the COVID-related deaths, which themselves are very alarming. And it's very difficult on my read of that paper to say what that really means. I don't think what it means is that people who today are at home feeling they have long COVID symptoms, that generally speaking, they're at a higher risk of death in the near term. That's not what this study is saying. I don't want people to be stressing about that. They have enough on their plate. I think what it's saying is that people who develop significant complications after COVID, some of those people have multiple other health conditions that may be playing into eventual death some weeks or months after their acute COVID experience. I'm guessing that that's more what's being picked up by this study. But clearly, one of the main takeaways from that study is the importance of having better documentation and definition of what is this long COVID thing we're talking about, so that we can draw useful conclusions.
If you were to give one piece of advice to people who are sitting out there concerned about long COVID, what would that be?
Well, if you're just worrying about long COVID in the hypothetical, I would really encourage you to avoid getting COVID through all the means we know can help. We were just hearing about them: vaccination and sensible behavior in terms of reducing your risk of exposure. But if you feel you may have long COVID symptoms, I encourage you to participate in our study or other research, because I think that's what we really need now is just a lot more information about what's going on, and to turn that into practical advice to help clinicians and patients figure out how to navigate this.
Dr. Leslie Fellows, thank you for joining us and helping us understand this.
My pleasure.